Hello viewers. Today my lecture is on pharmacoeconomics. Before I move on to the topic, let me introduce myself. I am Dr. Shalini, Associate Professor, Department of Pharmacy Practice, KMCH College of Pharmacy, Coimbatore. In this lecture, I will be covering on what is pharmacoeconomics, definition of pharmacoeconomics, the evolution of pharmacoeconomics, purpose and goals of pharmacoeconomics. What is pharmacoeconomics? Today's cost-sensitive healthcare environment has created a competitive and challenging workplace for clinicians. It's a challenge for the healthcare professionals to provide quality patient care in the least expensive way. The competition for diminishing resources has necessitated that the appraisal of healthcare goods and services extends beyond evaluations of safety and efficacy and considers the economic impact of these goods and services on the cost of healthcare. With the minimal resources, an efficient use of the resources should be assured. Clinicians developed strategies that aimed at containing costs. However, most of these strategies focused solely on determining the least expensive alternative rather than the alternative that represents the best value for the money. The cheapest alternative with respect to drug acquisition cost is not always the best value for patients, departments, institutions, and healthcare systems. Quality patient care must not be compromised while attempting to contain costs. Medication costs keeps rising and there is a consistent pressure to decrease pharmacy expenditures and budgets. Clinicians or prescribers, pharmacists and other healthcare professionals become responsible to answer the question, what is the value of the pharmaceutical goods and services that we provide? Pharmacoeconomics is the discipline of placing a value on drug therapy which has evolved to answer that question. It is the subfield of health economics that uses research methods and analytical tools from various disciplines such as economics, epidemiology, medicine, pharmacy, and social sciences. Most of the theoretical methods of pharmacoeconomic studies are based on economics and social sciences. The products and services delivered by today's healthcare professionals should demonstrate pharmacoeconomic value, that is, a balance of economic, humanistic, and clinical outcomes. Pharmacoeconomics can be simply defined as the description and analysis of the cost of drug therapy to healthcare systems and society. Otherwise, it can be defined as the measurement of both the costs and consequences of therapeutic decision making. Moving on to the definition of pharmacoeconomics according to ISPOR. ISPOR stands for International Society for Pharmacoeconomics and Outcomes Research. It has defined health economics as the field of study that evaluates the behavior of individuals, firms, and markets in healthcare and that usually focuses on the costs, which is commonly known as inputs, and consequences, which is commonly known as outputs, of healthcare interventions such as the use of drugs, devices, procedures, services, and programs. ISPOR defines pharmacoeconomics as the field of study that evaluates the behavior of individuals, firms, and markets relevant to the use of pharmaceutical products, services, and programs, and which frequently focuses on the costs and consequences of that use. Now let us see the evolution of pharmacoeconomics. Although the economic underpinnings of economic evaluation can be traced back to the works of Dupuit in 1844, Wilfred Pareto in 1906, Calder in 1939, Higgs in 1941, and so on, the actual roots of pharmacoeconomics developed in the 1970s, following the evolution of pharmacy as a clinical discipline and the incorporation of the pharmaceutical sciences into the pharmacy curriculum. The first book of health economics was published in 1973. McGon, Rowland, and Bootman introduced the course material related to pharmacoeconomics into the undergraduate program and graduate pharmacy curricula as early as 1976 at the University of Minnesota. In 1978, they introduced the concept of cost-benefit and cost-effectiveness analysis. Bootman et al. Published an early article in 1979 in which cost-benefit was used to evaluate the outcomes of individualizing aminoglycoside dosage in severely burned patients with gram-negative septicemia. The actual term pharmacoeconomics first appeared in the literatures in 1986 when Townsend's work was published to highlight the need to develop research activities in this new discipline. The purpose of pharmacoeconomics is to describe and analyze the costs and consequences of pharmaceutical products and services, to analyze the impact of pharmaceutical products and services on individuals, healthcare systems, and society. Thus, the goal of pharmacoeconomic analysis is to identify, measure, and compare the cost and consequences of pharmaceutical interventions. That is, the comparison is made in terms of costs for the resources consumed and consequences as clinical, economic, and humanistic outcomes of the alternatives used in comparison. It provides a guide for decision makers on resource allocation but does not offer a basis on which decisions should be made. In pharmacoeconomics methodology, we have two main considerations. The first one is the costs and the second one is the consequences. The costs are the inputs, otherwise the resources utilized by the therapeutic strategy and or intervention under a study, whereas consequences are the outputs or outcomes, which is any end result of a particular treatment and or an intervention. In the methods to evaluate and compare the total costs of treatment options and the outcomes, consider an equation which has two sides. One side of the equation is the inputs, which is the costs used to obtain the drug, whereas the other side of the equation is the outcome, which is the health-related outcomes. The center of the equation is the drug product and is symbolized by Rx. If only the left-hand side of the equation is measured without regard for outcomes, this is a cost analysis. It is otherwise called as a partial economic analysis. If only the right-hand side of the equation is measured without regard to costs, this is a clinical or outcome study. This is not considered as an economic analysis because it concentrates only on the outcome. In order to be a true pharmacoeconomic analysis, both sides of the equation must be considered and compared, which means the costs as well as the outcomes should be considered and compared. There are various costs that is to be considered when you do a pharmacoeconomic evaluation. Similarly, There are various types of consequences which is to be considered when we perform a pharmacoeconomic analysis. So in my next lecture, we can discuss in detail regarding the types of costs and outcomes that is considered in pharmacoeconomic studies. This is my reference, and thank you viewers for patient listening.